This is Heroes for Zero, a podcast from Contec. I'm Daniel Crow. Empty tables and booths, placards reading recently sanitized, employees donning masks and gloves are just a few of the precautions taken in reopened businesses, stores, and restaurants. Lifestyles have changed in the US and around the world to quell COVID-19 infection rates. People are keeping their distance from each other and wearing masks to protect themselves and others. While social distancing and face coverings are vital in keeping the infection rate low, people often overlook high-touch surfaces, the battleground for dangerous germs like COVID-19. In this episode, we'll hear from a panel of our team here at Contec to discuss high-touch surfaces.
By mid-March of 2020, one could say that nearly every American was probably familiar with the term social distancing. But as we move into the back half of the year and return to opening our economy, the term high-touch surfaces is beginning to crop up more and more in the media and everyday conversations. We've assembled a panel of experts to define this term and talk about what it means to everyday workers and consumers. And I'd like to introduce that panel now.
This is Mark Weinsek. I'm a microbiologist with Contec and been dealing with how germs survive on surfaces as well as how do you clean and disinfect them for many years.
Hi, I'm Megan Shields. I'm a technical support specialist for Contec. I've been with Contec for 5 years, teaching end users how to properly clean and disinfect any professional cleaning industry, mainly in hospitals.
And I am Callie Ravendalen, the Territory Business Manager at Contec, over the last year and a half working alongside with our end users that range all the way from healthcare to schools and everyday cleaning building service contractors.
It's great to have you all with us. As the term high-touch surfaces enters our collective lexicon, it might be best to start with sharing a true definition of this term. I'll dish that to any one of you and would be very keen to hear your words on it. Mark, let's start with you.
Thanks, Matt. So it could be as simple as what it sounds like. Surfaces that are touched a high number of times, not because they're high and over our heads, but because we frequently touch those surfaces. And because germs can survive on those surfaces, that becomes an important way that germs can be transferred from one person to another.
Thank you for that. There are clearly high-touch surfaces in a wide array of environments, whether it's our workplace, our homes, schools, other public places like the grocery store or gyms. Megan, how would one go about identifying a high-touch surface wherever they may be?
I look at high-touch surfaces from the perspective of frequently touched surfaces. So depending on the environment you're in, that's going to change. In a grocery store, the obvious would be cart handles. The not as obvious may be the handles to open the refrigerated section or the freezer sections. In a gym, it may be a locker. It could be the paper towel dispensers. So I look at anywhere that people frequently use their hands to manipulate an object as a high-touch or frequently touched surface.
That's good feedback. I've observed a lot of people doing the old pull the sleeve down to cover their hand when they open up a door that they may have identified as a high-touch surface. That might not be the optimal way to do it. So how would you recommend someone interact with a high-touch surface if they've got no idea regarding the last time it was cleaned or disinfected?
Matt, that's a really interesting point that you bring up, because I think one thing that's really been a main focus is wearing gloves. And it kind of makes you wonder, when you touch those high-touch surfaces, is that truly really going to help with that? And so that when you say pulling down the sleeve, what does a glove look like in comparison to that?
Yeah, but thanks for that, Callie. I've seen a lot of people wearing gloves out in public of late, but I've also seen them do something interesting where the vast majority are touching a high-touch surface and then running their gloved hands through their own hair, perhaps picking up a piece of fruit, putting it back, then putting their hands on their shopping cart. I'm not sure that's the right behavior. Mark, do you have some thoughts on that?
Yeah, so I guess because we think about people wearing gloves in healthcare, but the key thing about gloves is you got to change them frequently. So they're just like your hands. They can pick up germs from surfaces just like your hands can. And so if you do touch many different high touch surfaces, you're going to transfer germs just as easily with gloves. So the key is you got to think of still what about what you're touching, and you've got to change those gloves frequently. It's kind of a way of doing rapid hand washing. So if we talk about washing your hands frequently or hand sanitizers as a way to kill the germs or remove them from your hand, just taking off a glove can be an immediate way to get rid of all those germs if you do it properly.
Well, that's good to know. If we're giving folks the benefit of the doubt out there in the public domain that they are cleaning those high-touch surfaces, let me ask this question. And Megan, I'll dish this question to you. For those charged with cleaning, sanitizing, or disinfecting these high-touch surfaces, what's the ritual that they should be performing? How much is too much, or is there no such thing as too much? How should these high-touch surfaces, once they've been identified, be addressed on a regular basis?
So I would answer this by saying that every facility or establishment needs to do a risk assessment of their particular environment. From there, they're going to determine what is the appropriate amount of time to clean. I've been in some stores where they're cleaning the keypads on a credit card machine between every customer. And that makes sense because you know that every customer coming through there is going to touch that versus cleaning and disinfecting every freezer section pull handle on the door. That may not be something that needs to be done between every customer. I don't think anybody has the manpower for that, but they're going to look at it and decide, what's our frequency of people coming through here and touching this? Maybe it's every hour. Maybe their risk assessment says a couple times a day. It's going to really default to the facility or the establishment to determine what is the appropriate cleaning and disinfecting schedule.
Good to know. Now, I've got family members who are frontline workers. I've got a sister who's a nurse in an acute care facility, and my son works as a grocery clerk at a local retail outlet. Both of their locations over the course of the last 2 months have closed on at least one occasion because someone in their workplace self-identified as having COVID-19 symptoms. What immediately followed was communications around deep cleaning that would take place in order to assure a healthier facility that was ready to reopen. So another buzz term that I'm going to reference here is deep cleaning. Callie, I know you're working with a lot of folks out there in the field. What do people really mean when they say we're shutting down to do a deep clean?
Matt, that's a great point, and this is something that's being brought up every single day. A deep clean means something different depending on the situation. Obviously, with COVID-19 happening right now and with how things are operating, we need to make sure that we are taking care of the health of the employees that are going to be in that everyday setting, as well as the people that are going to be going in there to be doing different activities, whether it's shopping, school, or moving forward, just going to work. And so this is so important, is knowing the difference between what they consider a deep clean, and the conversations and the questions that are being held and asked right now are really helping dig a little deeper into what a deep clean means to each one of those different facilities that we talked about. But not only what does it mean to those facilities, what does it mean to the people that are there? Especially with a specific, like you said, COVID-19 case coming out of it. I think it's really important that these facilities take extra precautionary to really help with those high touch surfaces and understand how it's safer environment moving forward.
And that's really what I was after. Mark, would you address whether it's appropriate to connect the dots or how one would connect the dots between high-touch surfaces and deep cleaning protocols? Are those two one and the same, essentially?
Well, again, it can be different in different facilities. I mean, sometimes I think the high-touch surfaces should be the focus of every cleaning. And so deep clean could maybe take you beyond that, beyond those high touch surfaces. So kind of like Megan was saying, there's a risk assessment and there's a tiered approach because we got to balance how long does it take to clean. And in some cases, if we're having to clean in between customers, we've got to do that very quickly. So deep clean can mean some different things. It's certainly the risk assessment goes way high once you know you've had somebody that's been diagnosed. So that changes a lot of the aspects once you know that there has been somebody. And the problem with this virus is there's so many people with asymptomatic infections that we don't know who's infected.
It's really a lot to think about. Even the term deep clean. I've heard a lot of different terms, actually. Cleaning, sanitizing, disinfecting. I've even heard the term sterilization, and I'm not sure I fully understand the differences between the two. And if I struggle from day to day, I'd imagine some of our listeners would. Megan, would you take a crack at helping to delineate clean from sanitize, from disinfect?
Yeah, so cleaning is the act of removing a pathogen from a surface. Depending on what you're using, you're going to get a different level of clean. So just a wipe of the surface with something that is not a high-grade disinfectant would be considered a sanitizing step if you're using a chemistry that is designed to sanitize. Using something that is a EPA-registered disinfectant, you're looking for a time frame that disinfectant has to sit on the surface and remain wet in order to achieve the desired outcome, which would be killing whichever pathogen you're targeting. That may be 1 minute, it may be 5 minutes. It all depends on what that chemical has been tested for. Sterilization is something that's going to happen at a very high level. You think of going into an operating room and you want your instruments to be sterilized. That's happening with extremely high temperatures or a very long chemical process. So nowhere that I know of in your day-to-day life is anything being sterilized. So everything's either going to be sanitized or disinfected depending on the chemistry application being utilized.
That's interesting. You talk about kill times. Mark, what's the surest way to know how long I'm supposed to leave a surface wet with disinfectant before it's okay to wipe it clean?
Well, fortunately, the EPA, the Environmental Protection Agency, regulates all these sanitizers and disinfectants. So if you're able to actually purchase a product made by one of these companies that registered their products, then you will have all that information on the back of the label. And so oftentimes sanitizing is something done in the food industry, and it's a faster process. In other words, a chemical can sanitize a surface faster than it can disinfect. And you're basically trying to just reduce the number of germs by a certain level. And it can happen very quickly in seconds. But to disinfect, you're now trying to kill very dangerous pathogens and trying to potentially kill millions of them on a surface. But all that information about how long the surface must remain wet with that chemical is on the back of the label, as painful as that can be to read.
Thanks for that. Callie, question for you. I've heard terms like cleaning for aesthetics, and I've heard another term, cleaning for health. Could you explain to me the difference between those two? I guess one is cleaning for appearance's sake, and the other is cleaning for health. How would you define the difference?
I think this is something that truly is going to be a conversation moving forward. And it's something that's been thought about in the past, but I think the true meaning between appearance and health are really going to be something that people are really trying to decipher. And so appearance, like we talked about with Dr. Mark saying, hey, how long a disinfectant needs to stay on there, that's important when it comes to health, because that's going to actually reduce the certain amount of germs or kill the actual germ that they're trying to clean there. So for health, that's what I would say. Appearance, I see a lot of people, for example, I've seen gyms that just have wipes to clean. And it's more the thought process. As humans, we all want to see appearance. It's the first thing we naturally are drawn to. And I think that's going to be something moving forward that a lot of different facilities need to consider. Are we truly, what our end goal truly going to be to clean for that health and kill, or just for the appearance? And this is where I get questions all the time of where do you decide whether to sanitize or disinfect? And I think that's going to be a question that's going to continue to come up.
Thank you. I'm going to close with a challenge for each of you. I've given each one of you a single disinfecting wipe, and I'm going to send each of you into a different environment. And in that environment, with that one wipe, you can only disinfect one surface. Callie, for you, it's going to be an office building. Megan, for you, it's going to be a school. And Mark, for you, it's going to be your own home. So I'll start with you, Mark. You've got one wipe to use. What are you using that disinfecting wipe on in your own home?
Well, that's a personal question. And I would have to say for me, it's probably going to be the refrigerator door. So that has to do with, again, how many people in my family are going into the refrigerator. And if not all of them are social distancing and they've brought some germs into the house, that's probably in my house the greatest place for those to be spread.
I tell you what, in my house on quarantine, it's open so often we should probably just leave it open. Callie, over to you.
You're stumping me with this one. There's a lot of different places, but if I had to pick one, I would most likely do the handle when you walk in that front door. I think it's so important as people are going back to their offices, and if you're coming across other individuals, door handles are going to be a main point that are being touched several times a day. Okay,
and Megan, I'll let you bring it home.
That's a tough one. There's so many places I would want to wipe everything down. I'm going to go with the little push button on the water fountain.
Ooh, good call. Those are my questions. I want to thank our panelists for sharing their thoughts and views, as well as their expert insight on high-touch surfaces, deep cleaning, cleaning for health, and how they'd use a single wipe in different environments.
Preventing contamination can be a confusing and tiresome task, yet it is necessary to keep the population healthy and safe. Identifying and properly cleaning and disinfecting high-touch surfaces is a significant step in the right direction to prevent further infections. High-touch surfaces can easily go unnoticed. It seems like an unconscious task to type on your keyboard, open the fridge door, or drink from a water fountain. But on these surfaces could be harmful germs waiting to spread. Have you done a risk assessment of your high-touch surfaces and the cleaning procedures behind those? Let us know. Email us at learnmore@contecinc.com. Thanks for listening.